Welcome to the SABC Digital News Science Web. This week on the Science Web, we look at the University of Cape Town's call for more awareness on heart diseases. We also look at reports of cases of swine flu in Syria. But first, let's hear the latest on Ebola. The World Health Organization says West African regions affected by Ebola have this week reported their lowest confirmed cases in a year. 30 confirmed cases of Ebola were reported in West Africa in the past week. The organization says this number is the lowest weekly total since the third week of May last year. The virus is receding in Liberia, which reported no cases in the week to April 5th. Sierra Leone reported 9 cases, but it was its 5th consecutive week of decreasing cases. Guinea had 21 new cases, and the World Health Organization says this can be attributed to unsafe burial of bodies and unknown chains of transmission. The organization has called a meeting of independent experts to review whether West Africa's Ebola outbreak still constitutes a public health emergency of international concern. Next, a Syrian state news agency says 2 Syrians died of swine flu last month and 6 others were suspected of carrying the infection. The agency says the 2 men were from the southern province of Syria, where government forces and rebels have clashed. In 2009 and 2010, swine flu spread from central Mexico to the rest of the world. Researchers from the US estimated that it killed almost 300,000 people in 12 months. The World Health Organization has warned that the collapse of the Syrian health system during its 4-year civil war has led to the spread of the disease. And finally, heart diseases are now the leading cause of death in adults over 60 living in sub-Saharan Africa. The head of the University of Cape Town's cardiology department, Professor Mbiko Nseke, says there is a need to emphasize education about the effects of lifestyle choices and its contribution to heart diseases. Nseke says heart attacks and strokes can be prevented by simple things people can do, like stopping smoking, starting to exercise, and eating well. But for those who find themselves already suffering from heart diseases, Nseke says there are non-surgical procedures available to help them. One such procedure is called the percutaneous coronary intervention. That's it from the Science Web this week. See you again next time.